The goal of the Magee-Womens Heart Program is to focus on women's heart disease, to improve the diagnosis and treatment of that disease, as well as to educate patients and physicians about women's heart disease. The approach of the program is interdisciplinary. We include a lot of other physicians, including obstetricians, maternal-fetal medicine, breast cancer physicians, and most importantly, the primary care physicians, to help see and diagnose the symptoms that women present with. The main reason that women's heart disease is undiagnosed or underdiagnosed is that the definition of heart disease in the first place was based on man as the standard. And so it's been years in the making that we've been studying women and how they are different than men. And we are just now coming to understand how their symptoms are different and how their disease essentially is different than men.
Women share a lot of the same risk factors for coronary artery disease with men, including age, diabetes, high blood pressure, high cholesterol, and obesity. There are some risk factors for coronary artery disease that are unique to women, including starting your menstrual period early, having an early onset of your menopause, pregnancy-related complications like gestational diabetes, preeclampsia, or gestational hypertension. To help women understand their risks for coronary artery disease later in life, they can start by talking to their primary care doctor or their OB/GYN at their annual visit to determine what their medical history and lifestyle risk factors are. Once a woman is aware of her risk factors, there are some things she can do to reduce her chance of having a heart attack or stroke, including a heart-healthy diet, regular exercise, quitting smoking, and of course, regular follow-up with her doctors.
The reason that women don't recognize the signs and symptoms of heart disease is because there's a big disconnect between what women feel is their major health risk and what it actually is. Most women feel that cancer is what they're at most risk of, when in fact 1 in 3 women will die of cardiovascular disease. Cardiovascular disease will kill more women than all forms of cancer combined. So women can present with both typical and atypical symptoms. Typical symptoms are still most common in women: central chest pressure radiating down an arm or to the jaw. However, atypical symptoms, severe jaw pain, nausea, vomiting, pain that radiates through to the back, and even fatigue is a very common presentation of cardiovascular disease in women. Also, the symptoms tend to be triggered by not only physical activity, but also emotional stressors, lack of sleep or anxiety, and in which case they get attributed to other things, and we miss the fact that they're coming from our hearts. So women, we can change this pattern. What we need to do is start paying attention to ourselves. We tend to put our children, our spouses, our family, and everybody else's needs ahead of our own. We need to pay attention to what happens when I walk to the mailbox, when I push the grocery cart, when I go to pick something up or carry clothes up the stairs. When women communicate with their primary care physicians, they need to advocate for themselves. A lot of times it's thought that our blood pressure is elevated because we're anxious or nervous, when in fact we have high blood pressure, which is one of the leading contributors to cardiovascular disease later in life. Also, we may be emotionally upset about something that may be causing chest pain. This chest pain is real, it's just brought about by stress. And we need to understand that that's real, and we need to voice that to our physicians.
The most powerful thing for me about this program for women is that it's a place for them to be heard. It gives them resources for them to understand their disease, as well as guidance for them to manage their disease moving forward. The Magee-Womens Heart Program provides the most comprehensive care for women's heart disease in the region. We provide resources not only for patients, but also for physicians. We make a lifetime commitment for women living with heart disease.